Bed bath, partial, face, arm, hand, and underarm. Hi, Miss Bonnie, it's Vicki, your CNA. Sanitizing my hands, covering all surfaces. Miss Bonnie, I'm here to do a bed bath.
Okay.
All right, so I'm going to gather my equipment. I'll be right back.
Ever.
Pulling my privacy curtain. So I have a towel, bath blanket, a clean gown, 3 washcloths, basin, and soap. I'm going to gather some comfortably warm water. Now I'm going to get my warm water. So on the sink, the warm water is usually on the left-hand side, and you only need about 2 cups or so. You do have to wait for the warm water to come out of the sink. The water is warm. I have about 2 cups. Now I'm headed to the bedside. You don't need very much warm water. Probably about 2 cups or so is sufficient. In this skill, it's optional to wear gloves. If you do wear them, you don't get extra credit, but it's your decision, so I'm gonna not wear gloves. You having a good day today?
Uh-huh.
And I have my hamper here. I'm going to start out by covering you with the bath blanket. For both warmth and privacy. Do you have any special plans today?
No, not really. I'm reading some good books.
Oh, I enjoy that too. All right, now that she's covered, the top linens get fan folded to the foot of the bed. That's an important step. And it's to the foot of the bed, not the knees, but the foot of the bed. So there it is, at the foot of the bed. And keep her covered with a bath blanket. Next step is to remove your gown. Go ahead and relax. And make sure the patient stays covered while you're removing the gown. Remember, when patients get a bath, they have to be undressed. So remove the gown towards the foot of the bed, not towards the patient's face. Put it in the dirty hamper. We're going to start out with the face. We're going to wash her face with just water, no soap. Again, if you want to wear gloves, that's acceptable. And the washcloth, I'm just going to fold it into 4/4. All right, Miss Bonnie, we're going to start with your eyes, inner to outer, and it doesn't matter which eye you start from. Inner to outer, clean portion of the washcloth for every wipe. Clean portion of the washcloth for every wipe. Now the right eye, inner to outer. Clean portion of the washcloth for the rest of the face. Should feel better after this bath. It's always refreshing.
My face feels great.
All right, so I'm done washing the face, no soap, and now I'm going to pat dry. Okay. Take the same towel, put it underneath the arm. It doesn't matter which arm you wash. Since I'm standing on this side, I'm going to wash the right arm. we're gonna wash, rinse, and dry the arm, hand, and underarm. You do have to clean the underarm in order to get credit. So put soap on your washcloth. Don't put soap in the water because then you won't have a rinse. So put soap on your washcloth. Don't wring it in the water, otherwise it could turn into soapy water and then you won't have a rinse. Okay, here we go. Washing the arm. Washing the hand. And then washing the underarmpit. You must wash the underarmpit. It's required. That's the wash. Now the rinse. No soap. Fold the washcloth in the same way. Washing, rinsing the arm. No soap. The hand. Okay. And now the underarmpit. Again, you must wash, rinse, and dry the underarmpit to get credit. Take the same towel that's underneath the arm and just dry. Dry the hand. Dry the arm. And dry the underarmpit. Remove the towel, put it in the hamper. Let's put our clean gown on. Are you starting to feel pretty refreshed?
Yeah.
Bath does do that. Let's get your arm through. Okay. Now we're going to take the bath blanket out. Maintaining her privacy, she's covered. Keeping the soilage contained. Putting the bath blanket in the hamper. Covering up the patient. Are you comfortable, Miss Bonnie?
Yes.
Okay. We are going to lower the bed. Open the curtain. It's okay to multitask. Alrighty. Here's your call light and here's your water. I'm going to empty out the basin and I'll be checking on you later.
Thank you.
I'm going to empty, rinse, and dry my basin and return it to storage. Empty. Rinse. Doesn't matter the temperature you use for rinsing. Dry. Doesn't matter how many paper towels you use. Dry the basin. Throw your paper towels away in the trash. Return your basin to storage and return to the bedside. Sanitize my hands. And skill complete.